I think, as a company, we have to constantly invest in innovation, and that's what we do.
First, the government invites all these people to invest in India. Yeah. And then they say, okay, buddy, I'm going to tax you on this and this. So it's not your choice as to what you're going to do.
If you really have to be a global enterprise, right, you have to be innovative.
India's laboratories are busy producing fresh research and new pharma molecules every day. But yet, India has not managed its miracle molecule so far. Companies such as Glenmark realize that a slowdown is a period when research can be consolidated and given a fresh boost. The firm has over two-thirds of its turnover coming from overseas and is now putting additional investments to innovate during a period of global crisis. Glenmark is looking at additional investments in research and development, making India a hub for biopharma and focusing on branded generics for high margin.
Great pleasure to catch up with Glenn Saldana here at his facility in Navi Mumbai. Thanks very much.
My pleasure.
How are you surviving the slowdown?
Well, the economic slowdown, although a global phenomenon, the pharma industry is relatively well insulated from what's happening in terms of the global economy today.
Yeah. But what about the Indian economy? Is that sort of making it harder to perform?
Well, I think, India, consumption of medication doesn't get affected to a great extent. Although the environment is very competitive, lots of players, lots of new players, lots of big pharma companies trying to penetrate the Indian market. So there are lots of challenges in the Indian economy overall. But I think all in all, our industry is better poised than many of the other industries in terms of growth and in terms of profitability compared to what's happening in the environment.
Right. The fact that you're a defensive sector, it sort of kicks in during a time like this when all other sectors are getting impacted by policy, by general demand slowdown. How does pharma sort of use a crisis in the economy?
Given the fact that a lot of the Indian pharma companies, the leading Indian pharma companies are export oriented, almost, for Glenmark for instance, almost 75% of our revenues comes from international markets. With, of course, the rupee depreciating is helping a lot of the companies. So this is just one example of how, despite seeing an economic slowdown and currency fluctuations, the overall industry is benefiting. I think also our cost structures are much more competitive today.
Right. So are costs going up over the last few years?
I mean, clearly costs are escalating purely because of the kind of inflation we are seeing in India today is very high. So as a result, wage inflation is going up, increases are going up. So overall cost structures are rising in our industry overall.
That's interesting. We'll actually now head to the laboratory and catch up with Glenn on the specifics of what is likely to be the future of India's pharma industry. Well, so here we are at one of the laboratories at Glenmark's offices in Navi Mumbai, where things actually start happening. And they have been over the last 12 years.
Sure.
The story of Glenmark's dreams are actually coming into fruition. Tell us a little bit about what molecules, what stuff is already now getting ready.
Well, we've been doing this now for 12 years, right, in terms of innovation. We put our hearts and souls into innovation. And now, we've had a lot of successes. We were clearly the most successful company. 2008-9, we had a number of failures, and now we've actually picked the pieces together. And over the last 4-5 years, we think we've got a very good pipeline of molecules, right, which could potentially make it to market.
Right. And what are these molecules dedicated towards? Because we know that Glenmark has a huge pain segment. Right. You've got attention on asthma, diabetes. So the future that you're looking at, converting these molecules, where are they directed?
Our lead compound is a compound called Rivamilast, which is mainly in rheumatoid arthritis, asthma, and we have one more segment that we are pursuing with Rivamilast. We have a couple of molecules with Sanofi Aventis, which we've partnered. We have a drug for pain. We have another drug which is being pursued for ulcerative colitis. Then we have another compound called 17536, which is again in the pain space.
Okay.
So most of our efforts are in pain and respiratory as an indication.
Like any investor's question, I'm going to ask you, what is the potential of these drugs that will hit the market? Clearly, you've got a market size sense of what they might be worth.
I mean, these are all billion-dollar drugs, right? Multi-billion-dollar drugs. So, you're looking at multi-billion-dollar drugs with potential patent life of 12 to 14 years. So these are long, there's a long time horizon, right, for earnings potential on some of these molecules. But the good news is, we've done this for so many years. We've had our successes and failures, but the learnings, right, stay with you forever, right? So the future molecules, right, will come through at a much faster pace than what we did in the last 10 to 15 years, because now we know the game, we know the challenges, we know where we could go wrong, and we've modified our approach to make sure that now our success rate improves pretty significantly going forward.
Okay, in a time like this where, yes, some companies may still cash into a slowdown, but in your case, do you think innovation speeds up when the economy slows because you have time to think, strategize? How does it work?
Well, if you look at the global pharma industry today, most of big pharma, right, because of the kind of pressure they are under, given their product patent cliffs and the number of products going off patent, they've in fact cut back on innovation. Their primary focus today is generics, brand generics, more short-term opportunities where they can actually make quick revenues, right?
How are you all different?
The way we've built the business, right, is we started off with generics. So that's our mainstream of revenue. So we make a lot of money in generics, branded generics, right? And gives us stable revenues. And now we are hoping to use innovation to take us to the next level of growth, basically. Okay. So it's a slightly different scenario compared to what big pharma is going through. If I have to look into this decade and say, where's this industry going? I think big pharma will have a lot of challenges in this decade, whereas generic and brand generic companies will only go up and start to gain size.
What's the breakup of your business if you look at generics
So we don't have an innovative product today, right?
Yeah.
So all our revenues comes out of generic products and branded generic products or specialty products, right?
So look into 2020 and tell us that some of the innovative products that you're hoping to bring to market, do you envisage a split in terms of revenue?
Absolutely. So I think, we feel that, almost 50%, 30 to 50% of our revenues will come from innovative products in a 2020 scenario.
Okay.
And you're looking at one or two products contributing to that 30 to 50% at that point.
So you're a billion-dollar company today.
Sure.
These molecules already give me a sense that you'll be multi-billion by the time, or hopefully by 2020. As a promoter, owner, does it get harder as you go up the value chain, up the value itself?
Well, I think, the whole innovation space is very exciting, right? And if you really have to be a global enterprise, right, you have to be innovative. So I think you have to move up the value chain. There's very little choice. The generic industry, the brand generic industry is competitive and is going to be competitive in the years to come. So the only way to survive in the long run is to be innovative.
I'm sure that the government is actually listening to what Glenn has just said, because pharma and the future of pharma is actually going to define healthcare in India, and that's a very critical piece of India's own growth story.